This conference will now be recorded.
Good morning, everyone, and thank you for attending today's Goodhue County Economic Development Authority Summit. Today we have a speaker that will provide us information on helping my tenants survive tough times. And we are pleased to have Abby with us. For those of you that don't know me, I'm Ron Ziegler. I'm with Community and Economic Development Associates. Our agency serves as the staffing agency for the Goodhue County Economic Development Authority. These sessions are recorded, so they will be available through the Goodhue County Summit or Goodhue County website in the future. So Abby, if you'd like to go ahead and introduce yourself and go ahead and start into the presentation. Abby, you might be muted yet.
Yes, I am. Thank you. Good morning. Thanks, Ron. I am Abby Villaran, Goodhue County Social Services Supervisor at Health and Human Services here in Goodhue County. I supervise our adult mental health services and our adult protection services and some substance use services. My team is about half of social services. The other half is child and family services. So I have been here for 16 years. I've been in this role as a supervisor for 9 years. I am a licensed marriage and family therapist as well. So putting this together, I did do some just sort of overview of our agency here at Health and Human Services and then go into some specific services that we have to offer on my team. I think sometimes people aren't sure what happens in our building or what services we might have. So this is not at all an all-encompassing representation of what services we have here, but some specifics and then just some maybe helpful tips in a general way of working with people who might be escalated or in crisis. So next slide is just about what are the divisions here at Health and Human Services. So go to the next one. Just breaks down, basically, we do have 3 specific divisions that overarch many different program areas. So the first is economic assistance. And so that is child support, that is applying for medical assistance, different cash benefits, energy assistance, emergency assistance, those types of things along with childcare assistance. So they are a very busy place and important so that people have access to different care and some financial help when they're eligible. The other big division is public health, and so that includes family health that does WIC and a lot of family home visiting, Healthy Communities who has a lot of grant run programs, emergency preparedness, home and community-based services, the waiver, case management, disease prevention and control, immunizations, and we have our housing resource specialist is housed out of Healthy Communities in public health as well. And then social services that I'm part of does adult and child protection, adoption, adult mental health, case management, child care, adult and child foster care licensing, PSOP, which is our parent support outreach program, and some substance use disorder funding. So this specific presentation, I'll go over here what social services provides. And on this slide, the services that have an asterisk by them are the ones that I'll specifically be talking about today. And those are the programs that my team manages. So we have social services intake. So that is anyone who calls here, anyone who walks into our building, needing to make a report, asking for assistance with different things. We get lots of law enforcement reports. We get reports from medical providers, from therapists, any different way. We roughly get about 2,600 intakes here a year. Adult mental health case management, mental health outreach, pre-petition screenings for civil commitment, direct access for substance use disorder treatment, which has changed quite a lot in the last year or two, adult protective services, child protection. Truancy case management is a relatively new service that we offer Here in our child and family unit, we do adoption, we do foster care licensing for both adult and children, foster care, child care licensing, and PSOP. I'm going to just shut my blinds. The sun is nice, just not directly in your eyes. Intake at social services. So our building is open Monday through Friday, 8 to 4:30. That is when we're able to receive intakes in whatever capacity. Underneath there is the phone number to call, and that will get you to the main line and then to ask to speak to social services intake. We have a couple of main social workers that do our intake, and then we have backup intake. So it could be any number of social workers that you're speaking to if you're calling to make a report. You don't have to have all the answers when you call to make an intake or to ask questions. We always say it's our job to take the information and to write it up. And it's not the reporter's job to figure out like what we're going to do with it or if it meets criteria for us to do anything with. We have lots of mandates that we follow, lots of rules that are set out for us by the state. And so we apply all of those guidelines, rules, statutes when we get an intake and decide if we have a role or not. One thing that we like to tell people is the more specific information you have, the more firsthand information you have, the better. It really makes our job in screening a report in or out much, much easier if we have specifics. Some of this overlaps with a couple other slides, but just for example, sometimes people will call in and say that they're terrible living conditions. It's like a garbage house. And so my definition of a garbage house is probably different than someone else's definition of a garbage house. So if you can articulate, I think especially for landlords that might be seeing conditions of people's homes, specifics like you can't see the floor, there's rotting food, on the counter, there's spoiled milk in the refrigerator, there's bugs, like those types of specifics really help us weigh if we have a role or not. Names, addresses, phone numbers are very helpful also when we're looking at providing a service to people. Some of our services are involuntary, so that's child protection, adult protection, and we have pre-petition for civil commitments. Those are not voluntary services. Sometimes people have a perception that we have a lot of authority, that we really don't have a lot of authority in many ways on our own. We collaborate with the county attorney's office and with courts to get some of that authority, but we on our own don't have a whole lot of authority. And so that's kind of an interesting thing with social services. But we do have to follow up on those types of reports that are not voluntary services so that we can ensure safety and just overall care for vulnerable people. And remember that if you have an immediate crisis, law enforcement or one of the crisis numbers is a better way to go on an immediate basis. Of course, we'll take the information, but sometimes we're not able to respond immediately, the same as maybe law enforcement would. Okay. Adult mental health case management. This is something that my team provides. We, on average, have about 275 people open, either establishing eligibility or actually receiving the service. This is a service for people that have serious and persistent mental illness, which is a little bit different than having mental health issues or maybe another diagnosis that doesn't quite meet the criteria for SPMI. The next slide, which we'll go to in a minute, will discuss like specifics of what that means. We do need documentation from a mental health professional of this SPMI, which gets really challenging, especially when people are not well. and might be living in poverty and might be having some substance use issues on top of it. To get that diagnostic assessment can be kind of cumbersome for people, but in the statute, that is what we need to provide this service. The person also needs to be eligible for medical assistance to receive the service. Our case managers have monthly contact with their clients. And when the role of case management is to connect people with services, kind of assess maybe where they're at. What does this person need? Do they need help with employment? Do they need help with finding a mental health provider, a psychiatrist, transportation, housing? Housing is probably the biggest reason for referral for our, I would say all of our intakes, quite honestly, here at social services, but adult mental health case management folks definitely are needing a lot of housing when they're requesting the services. So we assess what are their needs, how can we help connect them with services, and then we monitor those services, offer support and a lot of advocacy for people. We are able to bill for this service, which is helpful for us to continue to provide services. The next slide talks about the definition of serious and persistent mental illness. So there are a couple different ways that people can establish eligibility to be seriously and persistently mentally ill. So obviously it's adult case management, so above 18. In general, psychiatric hospitalizations, like 2 within the last 2 years, continued hospitalization or residential treatment for 6 or more months within the last 12 months, treated by a crisis team at least twice in the last 2 years, civil commitment, which we'll talk about in a bit. If someone's been civil committed in the last 3 years, that also qualifies them, or if they had received children's mental health case management and is in that window between 18 and 21. The most common diagnoses which do qualify as a SPMI are schizophrenia, schizoaffective disorder, major depressive disorder, bipolar, and actually I forgot to put borderline personality disorder on this slide, so I'll have to change that. So one of those 5 diagnoses and has significant functional impairment and has that written recommendation for case management from a mental health professional. So kind of a lot of gobbledygook. And again, going back to the intake, no one has to have all this information when they call here because we are experts on how people become eligible for these services. And so it's always better to try to call or to ask the person, if they're open to these services, if they would call in. You don't have to determine if they actually are eligible. Okay, the next slide. Yep. So we were able to fortunately add a mental health outreach worker earlier this year with it's a provisional position that was paid for by this last round of ARPA funding. The last couple years with COVID definitely have seen more people struggling, people that maybe we haven't crossed paths with before, people that are struggling in a lot, I would say, more intense ways. And so as I just talked about our adult mental health case management, there's a lot of hoops to jump through to receive that service and to receive really a lot of services. And so we wanted to be able to get to people that we were aware of, maybe through law enforcement contacts or other providers calling us saying we're really worried about this person, they're in crisis, but we didn't establish eligibility for case management or another service, and they didn't meet the threshold of like involuntary services. But we knew that if we didn't get to these people, that they could very likely end up in crisis, which of course we want to avoid. We want people to be healthier, to be better. That serves our community much better as a whole. And so we were able to get these funds with the ARPA money, and so we do have a mental health outreach worker And so she's able to get to people very quickly who are in crisis. Lots of evictions, lots of homelessness with this group of folks, people that are frequently getting incarcerated, arrested, repeated hospitalizations, suicide attempts or suicide ideation, and lots of other high-risk situations, maybe child protection or other invasive restrictive services. So this has been a really great thing to add to the menu of services that we already have here. We are tracking the reasons for providing this outreach upon intake, and then we're also tracking when we're done working with someone what the outcomes were, so that we can really have a clear picture of who this group of people is serving and what interventions we were able to make. So it's been a really nice thing to offer people. Okay, and then one of the most restrictive things we have here at our adult services for social services is our pre-petition screenings for civil commitments. Lots of people don't know what a civil commitment is, and that is perfectly fine. So a civil commitment is something when someone is in danger of themselves or putting others in danger or unable to take care of themselves because of a mental illness and or a substance use disorder. Those are the main categories of civil commitment we deal with. There's other categories that are less frequent, but these are requests that we get here at the county. We are the pre-petition screening agency. So basically our social workers meet with a person or talk with a person and get collateral information. A lot of times we get these requests from a medical doctor when someone may be in a hospital setting on a 72-hour hold and the hospital provider deems them unsafe for release and they are not willing to voluntarily seek services that might make them safe for themselves or the community. This is a very time-consuming, thorough process. So we have to gather information, talk to lots of people, and then our team makes a decision of do they meet criteria to be civilly committed or not. Civil commitment is a really serious thing. It does go on people's background. It goes on people's civil record. And so it's something that we do not take lightly. We spend a lot of time very carefully talking amongst our staff here. If someone does meet the level of commitment, or are they willing to engage with us maybe with mental health outreach? Are they willing to engage in case management? Those types of things. We generally do between 30 and 40 civil or pre-petition screenings, and not all of those result in commitment a year. In 2021, we had 80 some, and so I think that was a pretty direct link to isolation and other struggles that people were having throughout COVID and the pandemic. This year, thankfully, we have leveled back off. So in this process, we write up our recommendation, we submit it to the county attorney's office. The county attorney's office reviews it. If they agree, then it's put on for a court hearing, a judge signs that, and the person, if they're in a hospital, is held at the hospital until that hearing. If the person is in the community, then they are made aware of when the hearing date is. Again, we want to avoid this. This is definitely like the last resort and the most restrictive. Sometimes people go to state-operated services hospitals throughout the state, which are very limited and long waits. People hold in ERs, people hold in the jails, people hold in the community for sometimes months to get one of these beds. Or people can be committed to receive services on more of an outpatient basis as well. So our case managers follow these folks along. Civil commitments are generally ordered between 6 months and 18 months altogether. Our substance use services has changed quite a bit in the last 2 years. We used to provide what were called Rule 25 assessments to determine if a person met criteria for commitment, or not commitment, treatment. And we no longer do those assessments because of many changes throughout the state system. We have many community providers that do provide substance use disorder assessments, which are called comprehensive assessments. We do some determination of funding eligibility still. And so people are able to contact us on intake and ask these questions because it is kind of a confusing, cumbersome system. So basically, we kind of answer questions, point people in the right direction. We do participate in Goodhue County Treatment Court. Lots of other county departments also participate in that, and community providers. At the end of this presentation, there is a list of substance use providers in Goodhue County. Okay, and then we do adult protection. And our adult protection reports all go to the state of Minnesota. There's a call center. It's called MARC, not the name MARC. It's MAARC, which stands for the Minnesota Adult Abuse Reporting Center. It is a call center that all adult protection reports go to. And then MARC, that call center, forwards them to the appropriate agency. Us at the county are one of 3 agencies that might be the investigative agency for the report. So we do not investigate reports that happen within like nursing homes. If it involves nursing home staff, or a group home, if it involves nursing or group home staff, we are responsible for reports that involve like family members, possibly if there's a financial exploitation of someone who's living in a nursing home or a group home, or other kinds of abuse, but not staff to like a resident. We do receive emergency protective services reports, however, that do happen in group homes and nursing homes. So we have to, within 24 hours, establish that the vulnerable adult is safe. But just to kind of remember that we don't investigate all adult protection reports. So we receive these reports, then we go through the same screening process as I mentioned before with other program areas, and we see, does this report meet criteria for doing something, or does it not? It gets really confusing about who's a vulnerable adult and who's not a vulnerable adult. So I think we'll go to the next slide, and that talks about who is a vulnerable adult. Again, you have to be 18 years old or older. Being a resident or a patient at a licensed facility makes someone a categorical vulnerable adult. And if someone has a physical or mental impairment that, completely impairs their own care, and this is kind of the key part with this, just because someone has some kind of a diagnosis on its own does not make them a vulnerable adult. They have to be unable to report or to protect themselves from the maltreatment because of their mental or physical limitations, diagnoses, etc. So just because someone might have a mental health diagnosis, for example, that alone does not make someone a vulnerable adult. Just because someone is 70 years old, which is not that old, that does not make them a vulnerable adult in the state of Minnesota. There are states, I think it's Washington or Oregon, everyone over the age of 65 is considered a vulnerable adult. Minnesota is not like that. And so it does get tricky with our adult protection because there's not a magic age that someone becomes a vulnerable adult. So we really rely on the information within the report about why the person is vulnerable, how are they not able to protect themselves, what are their limitations, those types of specifics. So it does get a little tricky to determine who is a vulnerable adult. So we need to make sure, 1, that the person really is a vulnerable adult, and 2, that the information in the report does meet criteria for investigation. So those are kind of the two things we're looking at when we're receiving these reports. So we get a lot of self-neglect reports. So that's, someone feeling like the person is not safe to live on their own. Maybe they're not turning the stove off and they've caused a couple little fires in their place. We get a lot of reports about conditions of homes, like garbage house type situations, lots of financial exploitation cases. Those are our more common areas that we get these reports on. We are growing and growing and growing in terms of how many of these reports we get and how many we investigate. We try to connect people with services through these investigations. Sometimes the outcome is that someone isn't able to stay in their home and they're in need of a guardian. So that guardian makes those decisions for the person. Again, that's like the least, we don't want to do that. We want someone to be able to stay in an independent situation safely. Our goal with these assessments is, just to make sure people are safe, they have what they need. And so we generally are not involved for a really long time when we're doing these adult protection assessments. And then the next slide, I kind of touched on this before, but especially with these adult protection reports, because we are not the people taking the reports, that MARC call center is taking the reports, the more specific information that you can put in those reports or tell the call center people, the better for us. So again, just some examples, more details, the demographics of a person, where they live, and if there's someone who's causing that maltreatment, that information is really good too. And again, the more specifics, the better in terms of what something looked like, what something smelled like, those types of things. The next, just kind of switching gears, is just a really quick illustration on the mental health services that are available, not necessarily all in Goodhue County, but just available to people. So on the left-hand side, that's prevention. We always want to be, if we can be on a prevention level, that saves us from going down the treatment road all the way over on the right. So that just kind of outlines, sort of least restrictive to most restrictive services in the mental health world. What do we have here in Goodhue County? So we have mental health providers on an outpatient level. We have a couple mental health agencies, and then we have independent private practice clinicians. Hiawatha Valley and Fernbrook Family Services and Nystrom are the biggest providers here in Goodhue County. We have substance use providers, inpatient and outpatient, and there's a specific slide on those providers. We do have a crisis center in Rochester that opened a little more than a year ago, and so people are able to go there, both child and adults, to get shored up without going to an emergency room. We have a 24/7 crisis response, and again, that number is listed on another slide. We have, obviously, you guys know, a ton of different providers, nonprofit agencies that deal with housing, that help people with in-home nursing, those types of things. And then we have all of our services here at Goodhue County Health and Human Services too. We are constantly trying to look at where the needs are, where the gaps are, and what can we do to try to fill those gaps. Is there a provider that can come in and do services? There's definitely services that we don't have here that we would like to have here so that people have access to them. Definitely our website, we're working on updating that as well, but that is another place where there's information on some of these services. Just a kind of capturing our, what we see as barriers, which I know is not just here at social services. I think probably just a lot of providers see this. Transportation is really tough here. I think in a rural area, the distance sometimes between someone's maybe mental health therapist and where they live is really tricky. There's not a lot of public transportation. It's very time consuming. Obviously, gas is expensive right now, and when you live on a fixed income, that's more challenging. The staffing needs, I think, for a lot of agencies, definitely a big impact for people trying to get those services. Definitely a lack of mental health providers and stable staffing, just access to services. Sometimes people just don't know what's out there. They don't know how to ask the questions or who to call about those things. Housing, safe and affordable housing, and flexibility and background. So the eviction issue and some criminal background stuff definitely is a barrier for people to get into housing. Poverty, trauma, just we're seeing people that have so many issues going on at the same time, and that's really challenging on top of some of our systemic issues like lack of housing, lack of staffing, when people have many issues going on at the same time. And funding, money, right, is always a barrier. And then just quickly, I think it's important that we hear, and of course, many different agencies have values. These are really important to us. We really hold these very seriously and really are tied to our mission. So providing excellence, providing collaboration, and that's with you guys, with all of our community providers, and that includes people that are recipients of services. We want to collaborate with them. We want to hear how we can do better, what the needs are, those types of things. Being respectful, even when we're maybe not having the same opinion about stuff, really holding that to a high standard. Safety, child protection, adult protection, those civil commitment situations, really want people to be safe. I think the public health division here provided, some stuff around safety through the pandemic, and lots of other areas, and compassion. We want to always be empathetic to the people that we serve, to the community, and those things that we see and those things that we can't see about people. Everyone that walks through our door has a load that they're carrying and might come across a certain way, and that might be for very good reason, and to just be compassionate with them. Just a couple things about running across someone who looks like they might be in some kind of a mental health crisis, or they're just really dysregulated. I think staying calm is probably one of the best things, and staying regulated yourself, which is tricky. I think you could apply this to lots of things. I think dealing with children, maybe dealing with aging parents, dealing with, a client, a tenant that's dysregulated. Just a reminder to just kind of take a breath and make sure that you're regulated when we're trying to get someone else to calm down and we're not calm ourselves. That doesn't really work real well. Listening goes a long way. Most of the time, I don't think people want people to tell them what they think they should do, or suggestions, or a time when maybe what you did in a situation that might be helpful later, but in the moment, it just listening is helpful. Empathizing and validating someone's feelings, validation goes a long way too. People want to be seen and heard, and that often will de-escalate someone a little bit. And just giving space, avoiding judgmental statements, arguing, those types of things, and just asking, what can I do to help? Is there something I can do? Do you want me to, do X, Y, and Z? What do you think? Those types of things. Obviously, if safety is a concern, which does happen, calling law enforcement or crisis numbers is the best bet too. But I think just staying calm and listening is the best route to try to get someone to de-escalate. Just some resources, just revisiting our intake phone number. In those hours, mark the vulnerable adult reporting centers on there, the regional crisis center, and just our bigger mental health center phone number. And like I said, there's a lot more mental health providers in Goodhue County. And if people are wanting that, certainly we can get that to you, to anyone that calls our intake. We can get that. There's a list of substance use providers in Goodhue County. So we do have one inpatient provider in Cannon Falls. The others are outpatient, and they also do those comprehensive assessments to recommend treatment for people. And then just a really long list of crisis phone numbers and text numbers. Sometimes people don't know about some of these phone numbers or text numbers. We give like the top one, that is our 24/7 crisis response number. And so that is something that our region of counties, we do contribute money to provide this crisis response. And that number, if someone, so it does go to a call center, but they also can provide a mobile response. So if their team there of mental health professionals deems that the person that's calling or texting needs someone to go out, a mental health professional to go out, they do that. And so that's kind of a neat thing there. Sometimes there's frustration if people don't get through those types of things, but those bugs have been worked out for the last several years. If there's concerns, like certainly can let me know about that too. Whole bunch of really specific crisis lines specific to someone's cultural identity. The last phone number has gotten a lot of press and is something that's new to Minnesota and really nationwide. So it's a 988 text number. The one thing I just want to caution about that is the staffing isn't necessarily there. And so sometimes people are not getting a response with that 988. And so I really encourage people to, if you're going to recommend a crisis number, the top one is probably the best number to give people. The 988 was a federal thing that rolled out and there just wasn't funding attached. So states really weren't able to provide additional staff members to take those calls, to take those texts, to respond. So I know we internally have had people be pretty frustrated with lack of response, and that's unfortunate because usually if someone's going to have a bad response, they're probably not going to use it again. So those are good numbers to have. We definitely have those that we give out to people and have them readily available, sometimes even programming those numbers in to someone's phone is really helpful so that it's there, because usually when you're in a crisis, you're not thinking super clearly. So I don't know if anyone has any questions or anything that was confusing.
Thank you very much, Abby, for the information. Any questions, Laura, Stacy, or Maddie? If not, we will end the seminar, and we just appreciate the time and the information that you provided, Abby. There's a lot of stuff in there. Yep. And it's great stuff, and it's all things that we all need to be aware of. So if there's anything that we can ever do for you, don't ever hesitate to ask. So thank you, everyone, for attending. This is the last session that we have planned under this summit series. So thank you again for attending this session and previous ones. Have a great day.
Thank you.